education. And I gravitated to the health behavior program and this MPH program. I graduated in 2009, and I use what I learned in this program every day in my work. I am the project director for an anti-obesity initiative at WNED, and WNED is a public media station. They have 2 television stations and 2 radio stations. I'm affiliated with Think Bright and Well, which is a fairly new television station. And WNED is exploring how public media can assist with getting out the public health messages. So many people think of, well, when you think of public television, you think PBS, and you think childhood literacy. Super Y, that's a new one that I just found out about. Most of us are familiar with Sesame Street. And so public media has been a leader in early childhood literacy, and they're wondering if now, because of the needs of our country, if they can also be a voice in health literacy and addressing public health issues. My role is in community engagement, because this is a new area for public media. They really want to engage with the community and find out what the community needs are and interface with the community so they can appropriately address some of these health issues. So this project is a collaborative. We're working with other not-for-profit organizations, educational institutions who are engaging adults in the community, who are engaging youth in the community, and who are helping WNED connect with the community. As a collaborative, it's very challenging but very rewarding. I'm sure many people here work with collaboratives, you know. Different organizations have different organizational styles, different cultures. Each organization needs to work on the project in a slightly different form. There are turf issues to navigate. But the common thread is that everybody is committed to the goal, because it is public health and it is a matter of moving health forward in the community. So with that common thread, there's always some kind of a solution to create a project that is ultimately going to be successful in the community as well as for each organization involved. I do use the skills every single day. I was hired as the project director at an organization that doesn't have public health experience. So I sat down the first day, and it was like this project was in my lap, and it was up to me to make it roll. So I saved all my materials from all my classes, thankfully. And like Mike said, you really do use each area of public health. I was in health behavior, which, since this is an anti-obesity project, obviously I'm using that a lot, but the epidemiology, the stats, community health aspects, I use all of it constantly, and I'm always going back to the research, I'm always going back to the theory and the methodology,